I'm Faith Colas, Director of Advocacy Outreach and Community Affairs. On behalf of Dr. Eve Hall, CEO and President of the Greater Milwaukee Urban League, welcome to Conversation Wellness, a series that will inform you and keep you connected to the ongoing work of the Greater Milwaukee Urban League and the work of our community partners. The Conversation Wellness series is part of our mission to address health inequities and covers a wide range of topics, including but not limited to health, home ownership, employment, financial literacy, education, entrepreneurship, voter education, and family. Our goal is to empower communities and change lives. Before I begin introductions, let me remind you to keep your microphones muted. We will be recording today's series, so if you have to leave us for any reason or want to share today's session with others, we will be posting today's presentation on our website, tmul.org, on social media and our YouTube page. When we open the session for questions, please place your questions in the chat. I want to thank you all for joining us this afternoon. And at this time, I'd like to introduce to you our sponsor for today's Conversation Wellness, Rebecca Stanis, Marketing Program Coordinator for Humana Eye Care. Rebecca?
Sorry about that. Good afternoon, everyone. Thank you, Faith. On behalf of Eye Care and the Humana Wisconsin Medicaid team, we're so pleased to sponsor the Conversation Wellness series. As you may know, Eye Care is now a wholly owned subsidiary of Humana. This has enabled us in Eye Care and the Wisconsin Medicaid team to participate in many, many more of these types of events and to partner with community-based organizations like the Milwaukee Urban League. The Milwaukee Urban League is doing great work creating these opportunities to address the health disparities of the African American population. Men's health sometimes receives less attention, so we're glad that this is the focus of today's conversation. Thank you for letting us be a part of it.
Thank you, Rebecca, and the Humana Eye Care team for your support of the Greater Milwaukee Urban League and our ongoing efforts to address inequities by empowering communities and changing lives. We really appreciate y'all. And now it's my pleasure to introduce our Men's Health Month subject matter expert and presenter, Daryl Davidson, Director of the City of Milwaukee Office of African American Affairs and Fatherhood Initiative. Daryl promotes racial equity and inclusion in Milwaukee through citywide collaboration with a special focus placed on enhancing local capacity to improve life outcomes of boys and men of color, specifically and significantly marginalized from economic, social, educational, and political life. He is an advocate for men's health promotion and issues related to increasing the general life expectancy of males, boys, and men of color. Daryl, welcome and thank you for joining us today. The floor is all yours.
Thank you, Faith. And I'd like to also give a greeting to Eye Care as well as the Greater Milwaukee Urban League. Thank you so much for hosting us in this presentation today. This is a topic that's much needed. And I come to you from the city of Milwaukee as a representative of not only the Office of African American Affairs, which has a huge focus in improving the outcomes of African Americans in Milwaukee, but also the Milwaukee Fatherhood Initiative, which has explored numerous ways in order to address the issues surrounding health outcomes, social service outcomes, and economic outcomes, having fathers as the centerpiece to make sure that those improvements take place. Today, I do want to talk about Men's Health Month. Men's Health Month is the month of June, next slide, and it exists for the purpose of heightening awareness for preventable health problems, as well as encouraging the inevitable detection and treatment of diseases among men and boys as they age. So this month gives an opportunity for healthcare providers and public policy makers and social service individuals, the media, families. We want them to know that men's health is a priority, as it should be every year. But since 1994, we've been addressing it specifically in the month of Father's Day to make sure that many of the things that are in the community can be accessed, and a lot of education is going to be delivered. If you need more information about Men's Health Month, I encourage you to go to the national nonprofit organization, the Men's Health Network, which is located in Washington, D.C. Take a look at their website. You'll find so many activities that you can do during Men's Health Month, as well as you can get research articles. And they also have promotional materials if you want to have Men's Health Month or any type of Men's Health Week activities during the year. So I'm encouraging you to do that. Why don't we go to the next slide as we talk about why we would have men's health as a priority. The reality is that the last 11 years of most men in our country and in many places around the world are years where men are going to be in poor health. And this isn't because necessarily of a Y chromosome. This has more to do with behaviors and activities that are practiced on a regular basis, starting at around age 12. So in other words, the vast majority of men's health issues are not genetically based. Let's take a look at the realities. Men are living fewer years than women, so it's a lower life expectancy. Men are also dying at the workplace more often than women. As a matter of fact, it's 94% of workplace fatalities are male workplace fatalities. And also consider this, that the most dangerous occupations that we have in our society are usually filled with men as the ones who deliver those services. I do want to also remind you that because we're talking about health in general, let's explore the prevention side of it. Now, it is true, men have a higher consumption of alcohol, but that does not necessarily mean that alcohol is the problem. There's chronic illness that will be associated with larger consumption of alcohol. Men and women will smoke cigarettes, but what we're finding is that men are inhaling deeper when they smoke cigarettes and are more likely to have a more higher frequency when they are smoking. So those types of consumption practices make a difference in long-term health outcomes. And we're concerned about that because it's increasing our injury rates, our morbidity rates. We want to do something about it. And this is the reason why we introduce this information in a program like this one. Next slide. So moving forward, I still want to acknowledge that Men's Health Month covers prevention. Now, we still are aware of what happens when people drink more water or when they eat more healthy food, which would include a higher consumption of fruits and vegetables. They lower their red meat content. They also cook their food properly, as well as consider that part of their regime around healthcare includes getting regular checkups and seeing their doctor once a year. Now, if those things aren't happening, it makes sense to have a conversation around it. And mental health is now a big area of health that's being explored. If men are living in isolation, if men are not having conversations around what those annual checkups are supposed to be, or they don't really have an indication of what it looks like when they are generally in good health, then they need to at least have somebody, almost like a buddy system. If it's not a significant other or a partner, it should be a relative, but somebody who they can get them to remind them to put annual checkups and preventive services on a calendar, or find a way to associate it with something that might be going on every year. It could be a birthday, or it could be a particular holiday, or another type of anniversary. What we're seeing is women are 100% more likely to visit the doctor for annual checkups and preventive services than men. That is a fact. But let's talk about why that is. Around puberty, women are introduced to the concept of health practices and seeing a doctor, and they often will visit the doctor in advance of that visit and find out what they're supposed to expect. And from that point forward, often, especially if there's cases where there's health insurance is supporting them, often you'll find that women are making regular appointments to the doctor or to a healthcare provider because they understand that this is a routine. Men, on the other hand, often will not see anyone, especially if they did not have a school nurse, or if they did have a school nurse from that point after high school, they're usually not going to see anyone in the healthcare field until they have symptoms. So, in other words, there's pain, there's pressure, there's something unusual happening, there's bleeding. And usually, when we get to that point, now you may have something that's very severe. The regular screenings, the annual checkups, those are the types of things where someone can make a comparison. If you have a relationship with the healthcare provider, they can make a comparison between when that man or when that young man is healthy and when they are unhealthy. And those comparisons make the difference in the decisions that are being made later regarding what they're going to do about their health decisions. Let's go to the next slide. So the elephant in the room, because many of the viewers on this webinar are African American or have a particular focus on African Americans. And I want to acknowledge that the rates of African American males in comparison to white males and other males in general is worse. We're seeing a lower life expectancy. We're seeing higher rates of those chronic illnesses that I was talking about. We're seeing a concentration on severe health problems that seem to be consistent with lifestyle and that may be attributed to a lot of other things in society. But I want to break that down because what I don't want this program to do is put the focus and say that the specifics around African Americans and poor health or African American males and poor health is because they're African American or that it reflects a cultural or psychological defect. That's not what's going on here. What I want to acknowledge is something that was said in the novel in the 1950s by Ralph Ellison. It was titled The Invisible Man. And that novel describes some of the horrible activities that were going on that were trauma-inducing in the deep American South prior to the protagonist of the story, who goes unnamed, moving to the North and then experiencing racial segregation and racial discrimination as a Black man in the North. But when he talks about those regular activities, what he also is expressing is not just the physical trauma, but also that mental health and that spiritual breakdown that's occurring that's now leading to a stress that's almost incomprehensible because it's happening every day. So now what do we see in comparison? We see that people are encountering systemic oppression, they're encountering victimization, and they have to cope with it every day. And that everyday experience is also related to perhaps lower income or not even having employment on a regular basis. It also may include structural barriers, such as not being able to access the healthy food or not even being able to access health insurance in that circumstance. And now what we have is a person who starts off with the same type of potential as an infant to have a high life expectancy, but every year those stresses are lowering that life expectancy day after day after day. And when they are being denied coverage from healthcare, now we see circumstances where it escalates. And it escalates to the point where now we cannot do much else except start telling people, well, your life expectancy is now months from now instead of years. African Americans, male and female, have experienced worth, health, status, and outcomes, but African American males are really at the bottom of the totem pole. You take a look at the difference and the divide between the life expectancy of white women and Black males, then you see how pronounced these research data have been observed. So I do want to say that if African American males receive a 34% increase in preventive services and proper care, that means that they have regular screenings and regular checkups and a emphasis on health literacy so that they are able to ask questions around what's going on in their life, and do they understand what regimen has been prescribed to them, or do they understand the prescription drugs that they're taking and what they do and what counters their prescription medication, that could be supplements or anything else. Then we recognize that African American males would likely increase their lower rates of mortality just by doing those changes and just by making those changes in follow-up care. That's the reality that we also see. Something else to bring up in a conversation like this, everybody. The data that I'm giving is hitting the population no matter where in the country we're talking about. This is consistent. But when we talk about what's known as the social determinants of health, it is a fact that the neighborhood, and essentially we can take a look and track a particular zip code that a Black child is born in, we will see that they will be predicted to have a lower life expectancy, not just because of the zip code not having access to the health opportunities that we've described before, but also in the terms of social determinants of health. If you're in an environment where walking is no longer an option because the streets are not paved, or there's no sidewalks, or the sidewalks are in disrepair, or maybe if the evening is the better time to walk because of the heat, but the street lights aren't coming on, not effectively, now you have a condition where people are going to spend more time in the home. And there's an expression that's out there: sitting is the new smoking. We see a lot of men who are developing habits that are related to sitting behaviors. That could include video games and any type of other behaviors, passively watching television, Netflix, and movies. We see more of that, and we also are seeing higher rates of health problems, including cardiovascular disease, higher rates of diabetes, and ultimately higher rates of cancer too. Let's go to the next slide. I mentioned mental health, and I just talked about inactivity. So inactivity is an area that we don't talk about, but it does lower all sense of the body having the desire to motivate itself. And it begins to show up mentally, and ultimately it starts showing up physically too. Inactive men are 60% more likely to suffer more cases of cardiovascular disease, as well as they also are suffering from higher rates of depression. When we talk about depression, that is a diagnosed condition, but that's not the overall element that's important with mental health. Mental health, just like physical health, is an area where it is constantly something that needs to be addressed. If we're not regularly exercising, then our physical health may be poor. If we're not constantly bringing in nutritious food, our physical health may be poor. If we're not constantly bringing in positive information, our mental health begins to suffer. If we rely on ourselves and try to solve problems that are insurmountable and we put ourselves in isolation, if we do not talk to people about ways of getting around certain challenges that might be more applicable for teams instead of an individual, if we take on the burden of other people's problems, these could be family members, this could be someone else's financial issue that we want to make sure that they don't have problems with it, and yet we don't tell them what it takes in order to make that happen. We're not letting them know that we're working extra hours or that we're doing the type of work that's probably damaging our body, but that's the way to get that income. We are ultimately going to experience more mental health problems that way. That is through our own behaviors. So we really do have to make time to start addressing our behaviors. And we always have time. As long as there's 24 hours in a day, there's always time to address our behaviors. And one of the earliest studies that researchers took a look at is, what is the effect of sleep on the body? Sleep rebuilds the cells in the body. Sleep gives the body a time to re-energized, and ultimately, the same thing happens with our brain and our entire mental health status. We know that people who are getting 7 to 8 hours of regular sleep are less likely to experience depression, but also they're less likely to experience a fatal heart attack than those people who are getting 5 hours of sleep. And let me also mention related to the mental health and the actions that go around it. I know I was talking about behaviors, but one thing that we're also seeing is that when men are addressing their mental health state and they're in a low mental health status, often they will try to self-medicate. So now you're going to start seeing more use of the alcohol and substances that are not changing their life circumstances, but is changing what's happening in their body. We also are aware that even though men and women are experiencing many mental health concerns in our society, the option for men is to take a suicide approach that's higher than with women, and usually they're more successful with it. So what we're asking people to do is start addressing their mental health. Start giving yourself time to heal whatever is going on during the day. If there's problems with the job, maybe it's a new job that's needed, or at the very least, if that can't be done immediately, there needs to be other people that we can talk to. Either these are going to be professionals, these are going to be our religious contacts, these might be individuals in our family, but we have to find a way to express what's harming us inside. And at the same time, we need to all get more exercise. In a recent conversation, we were talking about how do you get more exercise and you're still in the same environment? Sometimes it's if you live in a home, walk around the driveway more. Find ways to walk up and down the sidewalk more frequently. If you live in an apartment building, let's say you have stairs and an elevator. You can take the stairs more, the elevator less, or begin to take the stairs at a floor lower than your own. So at least every day, the individual would be able to take the stairs during some portion of the time that they are going to and from their routine. We ask that you first know what healthy foods are. So I did mention fruits and vegetables, and we have a variety of websites. We have books and nutritious information that you can find even at your restaurants. And here's the reality. Let's take a look at portions. Portion control has been one of the things that people obviously have control over. If you take a look at how much is in your diet, and if you're using boxes or cans, or if you're going out to restaurants, they often will give you what's the calorie content, and they'll tell you what a portion is. A portion could be a cup for a particular item, or for another item, it could be a fourth of a cup. But what you're looking for is, what are we putting into our bodies? How many calories are we putting in? And when we're controlling our portions, it's not just that someone gave us a plate full of food and we have to eat everything on it. We have to start making habits that are more proactive. So an example would be if we took the portions that we were not going to eat at that particular meal, let's say it's lunch, and we saved it for dinner, or maybe even saved it for breakfast the next day. Those are the habits that often will assist us. Getting regular checkups is a major part of our proactive activities. I'm here to also let you know that it doesn't take that much to get regular checkups. There's health fairs and there's events that are taking place. We know that even during the month of June, we have health fairs and events that are going on every weekend. So let's find some time and get that blood pressure checked, or get that blood sugar level checked. Something where we have an idea of what's going on. Talk to the healthcare provider about what would be an optimal level in your screening. Ask those questions, get more details, and I'm encouraging everyone, if you have access to our office at the Office of African American Affairs, if you want to get one of our cards, which has blank spaces on it, but it also has what are appropriate screenings on those cards. Whenever you get a checkup, you get the healthcare provider to write on the card what the reading was or what the screening level was. And then you can make appropriate comparisons based on date and based on results. We have no excuses. We should get out there and get those checkups done. As I had stated earlier, also, we need to all get more regular sleep. And I know, especially after coming through this pandemic, many of us were challenged because we made ourselves accessible to so many people that we normally didn't see on a regular basis. These are family members, something later in the night if we had that type of job that allowed us to do it. More people were doing overtime when they had that accessible to them. And now we're facing other challenges where it seems to cost more to live. So yes, it's important to recognize those things, but also don't have it take over our lives. We need to still rest. Sometimes rest also includes the habits that go around with how we consume media. Maybe we shouldn't be watching the news at 10 o'clock at night or 11 o'clock at night. We should be watching it earlier in the day and then stop with watching the television or with taking a look at what's on your tablet or the screen on your phone. Let's get away from that with a couple of hours before we have our bedtime. And speaking of which, we should all have a regular bedtime. Now, that regular bedtime does not have to be the same as everyone, but it makes sense to condition our bodies so that we are going to sleep at the same time generally every day or every night. If we're not getting that regular sleep at night, let's find some time in the middle of the day to take a nap. A 1 or 2 hour nap does wonders, and it also recharges that body. So it still is not the same as getting the 8 hours of sleep, but at the same time, it does promote more optimal mental health and physical health too. We have stresses just by existing. As I stated before, there's some in our society who are going to experience stress in the environment that's much higher than the general population. Our method of addressing stress needs to be a healthy method of addressing stress. Yes, walking may help. Yes, drinking water may help. Communication helps. It also helps to talk to our healthcare provider and find out if our body is changing because of the stress. And it could be many healthcare providers who have something that they can share with you. I know that there's dentists who talk to people about their level of stress because they'll notice that the person who's undergoing so much stress, their teeth begin to grind down. And once that's noticed, then that creates other problems where they cannot eat food that might be more healthy for the body because that solid food requires the chewing. So what we're looking for are healthcare providers to give opportunities that's going to reduce our education around and introduce information about reducing our education around stress and maintaining healthy relationships is another appropriate way to do this. So if we don't have a healthcare provider, we're going to have that person in our life who's going to function as our buddy. The buddy system is extremely important because that's the person who can also hold us accountable to schedules, as well as make sure that we're clear about the results of our healthcare assessments. It doesn't make sense to get those results about readings and about medications to take and about how to schedule the next appointment if we're not clear about why we are doing that. Again, I bring up our office at the African American Affairs Office with the City of Milwaukee. We have a health literacy project that's going on right now. We want to know what people's experiences are presently with their own personal health, as well as what they're going through with healthcare systems and their providers. Many times people are not listening to information when they discover that the person who they are talking to, who is supposed to be perceived as a healthcare expert, is not following up with information that allows them time to process in the appropriate amount of time, or will not give an individual time to ask questions where they really are concerned about the medication or their condition or what it means in the overall scheme of their life. Do they have to make changes in routines with their family or with their work schedule? And when that happens, then people leave frustrated, and that frustration brings about another level of stress that once again can usually be addressed if the preventive information has been delivered earlier. In the next column here, I have the systems approach to working with individuals, especially African Americans in this case, who might be at risk for poor health outcomes. For our physicians and our healthcare practitioners, nurses, we want them to meet the patients where they are. Everybody who's walking in the room does not necessarily know their family history. This is an opportunity to ask about what they do know, and also not just ask that question, but make a connection between the question that's being asked and the answer that's being given. So we want our healthcare practitioners to spend an appropriate amount of time with those patients or with those clients so that people are getting their questions answered. We also are aware of a couple of other things that are important in this category too. We don't want to create barriers by using language or larger words that typically might make the person who's coming in with the condition feel intimidated. So they don't believe they should ask a question because obviously this person who has a higher vocabulary, bigger vocabulary, knows more than they do. So why are they going to ask? I'll just follow whatever they say. Let's make ourselves the type of patient where we do ask those questions. And if we don't like the person because of how they're delivering the information or they are not answering those questions, if we have any issues with that healthcare provider, you don't have to keep the same healthcare provider. There's always a place where we can get a second opinion. And if we don't know where to get that second opinion, that's why we have places like the Office of African American Affairs, as well as other locations in the city of Milwaukee, where they can give us information about where affordable healthcare is in the city, as well as what to do to be a much stronger advocate for yourself. In that regard, we are also asking for healthcare providers to lead by example. So to lead by example, we want providers to ask pertinent questions versus dictating information to our patients. Ask pertinent questions, be patient with the answer. And if it sounds like the individual is not introducing the information or the questions don't seem to match what the condition is, now it's an opportunity to have the patient demonstrate if there's a regimen or a prescription that's given, have them demonstrate if they understand that they know what you said or they know what they're supposed to do after they leave the office. Now we have apps and we have websites that are connected to healthcare facilities. We have to use those, even if that means that we have to get a person from the families. Often it'll be a younger person of the family who's very comfortable with computers, and they may be the one who might have to go in and check that chart, that electronic chart that the patient has access to, and follow through with those emails that come in on those apps that set up appointments, or maybe need to change appointments so that you can see the person who you saw the first time and not go through the healthcare system seeing multiple providers. Because usually if we see the same person and they have that relationship, then they will know something that's different or something that may be unique to that particular patient that they can apply to a situation that can help them in the future. The other thing that we want to talk about is addressing what we're saying are the social determinants of health. And when I talk about the social determinants of health, once again, we're talking about the environment and the things that are generally outside of the control of the individual. So the place where a person is born, or the things in the community that people access. It does make a difference when we have schools and when we have places in our communities that do talk about preventive health to the point where now it becomes a routine. You don't have to have experts everywhere, but we do need to have ambassadors. We have the concept of community health workers that are in the community and provide people navigation on how they can get through systems that look really complex and incomprehensible if you look at a map on paper. Sometimes they may be the appropriate person to talk to when we know that a prescription is needed, or if we don't know where we can purchase that prescription or access that prescription at a lower price, or if we don't have health insurance, where should we go? That individual may be the person who's the lifeline to the healthcare provider. So they're known as community navigators or community health workers. And again, our health literacy project in the city of Milwaukee is promoting heavily the work of our community health workers, especially in educating our healthcare providers on where those community health workers fit in the overall system of healthcare. Speaking again of how to use technology, yes, it's true that the phone is technology, and there's often ways of using smartphones that can get us our appointments and get us into educational websites where we can learn about the condition that may have been diagnosed. We can also use that technology to identify when it's appropriate to seek medical attention if we have a particular condition that's been described. But just because it's been described does not mean that it does not exacerbate or get worse. So yes, it's true that a person may have high blood pressure or they may have high blood sugar, but they're supposed to know that just because that condition has been diagnosed, they don't have to exist with pain or being dizzy, or if they see blood or different colorations of their body. That's not the condition itself. That's something that's letting us know that perhaps the condition that's already been diagnosed is getting worse. Use the technology to learn that information or to access that information, communicate with our healthcare providers through their systems that are set up. They're basically emails and almost like text systems that can work with your phones or your computer technology and tablets, and then consistently use those. We even have applications on our watches now where we can count the number of steps, or we can identify our heart rate or our breathing rate just by wearing this other device that will help us. In the long run, consistent use of those devices is no different than seeing a healthcare provider in the sense that we want to get an accurate medical record of what's happening in between our healthcare appointments or what's going on in between screenings, and ultimately take a look at whether we're getting better or whether we're getting worse according to what those charts are telling us. Now, there's another element that is absolutely important here, and I'm connecting this bullet point, provide fair and equitable healthcare, to the bullet point above that says train a workforce that resembles the patients. Now, for those of us who may not believe that that's such a big deal, let me talk to you about a research study that was done recently. We had over 1,000 African-American males who were part of a research study that determined that their health conditions improved vastly differently in comparison to the African-American males who were seeing physicians and healthcare providers who did not resemble them or do not represent communities where they came from. And this was a landmark study that let us know, it reinforced that training a workforce that resembles the patient population isn't just about the aesthetics. It's also about the manner in which people are communicating with each other, having a clear understanding about certain practices or traditions that come from a particular environment that may be common in some families and people that might come from the same community. Yes, it's true. That means it's going to take a long time. So it makes sense for the systems of education and the legal system and the different sectors of business have to take a responsibility in assisting in identifying and recruiting people who can go into the healthcare workforce or the ancillary systems that support healthcare so that we can get more people of color, we can get more African Americans into the healthcare system as providers or as support teams that can assist with getting people from the patient population to the healthcare that they need. In other words, provide fair and equitable healthcare across the board. It makes no sense for a person to start off in a particular zip code and have an immediate advantage just by way of birth on how long they will live or how healthy they will be, or whether or not they will acquire certain illnesses strictly because of the way that they're ingesting foods and water and anything else that's in the environment, air. It makes no sense that some people, just by way of where they live, are going to have asthma or chronic lung disease because of where they were born and where they grew up. Those types of things are a priority area in public health, as well as now are being talked about in many sections of our community and in our environment. That makes all of us to appreciate what optimal health looks like. And so we do want to make changes in that area too. So I don't want people to believe that nothing can be done. The men's health data that I expressed already, that is part of a silent health crisis. We do have technology, we do have people in the community, we do have healthcare systems, we do have our own families, we do have our spiritual partners and our religious partners who can assist us with making this a priority. And so we don't want to be so self-involved where we're saying, I don't have enough time. And then the result is we become our own worst enemy. In other words, get it checked. Make sure you know what your healthy data is supposed to look like. Compare your charts and stats to what seems to be the more general stats of a person who is our age or our weight, our gender, our height. Those types of things do make a difference. And if by chance we are in a healthy state and we start noticing changes, it could be changes in coloration, or there could be the beginning of an onset of pressure or pain. Let's see somebody about it. Let's stop ignoring what's going on. The big thing that I always talk about related to men is men have been taught to ignore the symptoms. They've been taught to get past it, to walk it off. Well, now is the time in this year, at this moment, during this Men's Health Month, to make a condition to go against the tide, to start saying, I value myself enough where if there's any type of change that leads to pain or that leads to an unusual observation, I'm going to have somebody look at that, and that person is not going to be someone who doesn't know what they're looking at. It's going to be a healthcare provider or healthcare professional who is very clear about what to do as a response to that situation. So I'd like to go to the next slide. We have activities that are available to us, everybody. If you live in the greater Milwaukee area, we're encouraging all of us to take a look at June 30th from 8 to 11 a.m. in Washington Park. That's 4422 West Fleet Street in Milwaukee. Men's Health Month is being observed internationally, but it's also being observed specifically there. We want you to bring your families. We want you to learn about education and prevention. We want you to join the county executive and our city leaders for the Men's Health Month celebration, where there is going to be addressing physical health and mental health, walking and yoga and guided imagery, and a wide range of resources on health. That includes cooking demonstrations and proper eating habits. There's also going to be mental health support, and as I understand it, there's supposed to be activities that are going to assess where we are in our health status and give resources that we can be referred to so that it can be follow-up activity that relates to improving the health condition that you might have noticed at that particular event. So we want to bridge the gap in healthcare disparity by getting people out there and making them part of a community event so that they receive not only quality services, but quality education. And if you do come to that event, you'll also see representatives from our Office of African American Affairs Health Literacy Project, as well as some of the community health workers. We're going to be giving our survey on health literacy and how are we accessing information, as well as what's happening with us and our relationships with our healthcare providers, so that we could be successful in attaining the type of health we've dreamed of and increasing our life expectancy and changing those stats in the city of Milwaukee and places abroad. So let's go to the next slide, because I know that we have questions that are going to be asked, and I certainly want to make sure that we have enough time to make that happen.
Daryl, thank you so much for that very rich and informative presentation. I'm sure there are questions, if not now, later, that people may want to directly speak with you about. How can people reach you at the Office on African American Affairs and the Milwaukee Fatherhood Initiative?
Yes, they're in the same building. We're located near 48th and Fond du Lac, West Fond du Lac in Milwaukee. And we're preferring that people go ahead and call us, especially in advance of our events. We have our relationship with Men's Health as well as the Milwaukee Fatherhood Initiative, and we are hosting events directly connected with the Fatherhood Initiative in July. So please give us a call at 414, that's our area code, 414-286-0222. That's 414-286-0222. That is our City of Milwaukee Office of African American Affairs. We're also hosting other events that are taking place, which include educating people around health literacy and delivering the survey, because that's part of a grant activity that we're working with right now through the Office of Minority Health and the Department of Health and Human Services at the federal level. But the other thing I want to share with you is on Saturday, that's the 25th of this month, we're also at 11 o'clock going to have an event that's going to introduce us to the conditions that are taking place of substance abuse in the Milwaukee area and how we're doing interventions around that. So if you like to receive information on that, it's approximately 2 hours. So it's a presentation, but it'll function in a way like a training for 2 hours from 11 to 1. You can come to our office, you get to see where we are at our conference room, but also it's the same phone number to register to be a part of that session. And we love to see more people be a part of that. So that's our substance abuse session. And we'll still be talking about men's health during Men's Health Month. So that number again is 414-286-0222. That's 414-286-0222.
Thank you for that, Daryl. I've also put that information in the chat for all of our attendees and guests this morning. One question that comes to mind is, how can lowering the intake of red meat help men live healthier?
Well, lowering the intake of red meat has more to do with the relationship between the increase in fat content that is in the body. So we have a relationship between what happens with the diet, and red meat takes longer to digest in the system. The other relationship is that a high red meat content has been associated with the increase in what we'll consider to be clogging arteries, but ultimately the conditions that we look at with heart disease. And if we really explore what's really happening when we talk about many of the chronic conditions, what we really are looking at is lowering the levels of oxygen that gets to our cells and gets to our organs. And so there's other types of food. It could be white meat. It could be fish if we are eating meat. It could be a higher intake of fruits and vegetables. But those types of things allow the blood flow to remain constant without the interruption that might occur with the clogging or with the inflexibility of the arteries. The last thing I do want to say on this, again, it's not that we can't eat any particular food all the time. Most of the time, it's about eating or even drinking in moderation. Have the idea from our professional sources and resources, get the information to know what is the appropriate content for our body weight and our height and our size. And then we can begin taking charge of our health with portion controls, knowing what's the appropriate amount to drink or what's the appropriate amount to eat based on measuring it versus basing it on eating it because it tastes good either way.
I heard you, Gerald, make a suggestion on meeting patients where they are. So as a patient, and those of us that are female on the call, how can we help communicate to men some best practices on having a better relationship with health care providers?
The first best practice that our female partners or our significant other partners should start off with is having a discussion, not lectures and anything that might be perceived as punitive. What we want to start doing is making it a part of a regular conversation. Perhaps if we're in the car together, have a short health conversation about starting with how are you feeling or anything changes that you've noticed. This could be at the dinner table. Start writing the information down. So it could be half sheet of paper or an index card, something that's readily available. It could be the notes section of a smartphone. But start writing questions related to what's been going on in those regular conversations. Often we'll get into the physician or the healthcare provider's office and we'll have it in the back of our head. I don't know what's going to ask them that. I was thinking about asking them that. And they don't, because something took precedent in the conversation. It makes sense. It's your health. So have your own health agenda. Write it down. If you need to put stars on it, or if your partner needs to put stars on it and say, this is the thing that was worrying you most when you have that conversation in the car, that's what we need to talk about. Or if the question has been around diet or exercise or lack of, or sitting too long, then make sure that that gets addressed before walking out of the healthcare provider's office, or even in the case of the events that I was talking about earlier, where we're going to be seeing healthcare practitioners and providers in a community environment, take that list with you. Make sure that those questions are answered in an environment where people are comfortable answering those questions or can give you a resource that may be at some of these events across the table from you.
Daryl, in these presentations that you do, what are some common questions that people ask you that you can share with us, those questions and the answers to?
The most common questions that we receive are really focused on behaviors or habits that a person might have had growing up or that one of their parents might have shared with them as being an appropriate habit to have. An example would be, and remember, I'll keep it general here. This is not to say that we're beating up on people's traditions. That's not what this is about. But people have been taught, drink sugar in your water, put sugar in your water because that makes the water taste better, and then you're going to drink more water, or introduce more flour to children early or in their lives. And there's no difference between some canned foods and some fresh foods, and that's all we had access to. And I was told that there's no difference. Another one is not identifying on the there's the nutrition charts, and it'll identify what particular food groups exist, and misidentifying what's in a food group. So for example, corn is not a vegetable, it's a starch, but we have individuals who were taught that it's a vegetable, just like they're taught that potatoes are vegetables. But once again, those are starches, and we're seeing more weight gain with that. I do want to emphasize that it's not about just throwing the family traditions away, but having a better understanding about how it fits with caloric intake, and also if we're using condiments or something else to have our foods taste better. There are options other than salts that can make the food taste better or just as good. And as far as it goes with water, water is one of the most pure things we're ever going to find on the planet. We have to get used to drinking it in the form that it is, or find other ways to bring water into our body that may not necessarily be just sitting down and drinking a glass of water. But ideally, we should be drinking enough so that we never are thirsty. That's really the key. We're not supposed to feel thirsty.
And before we let you go, we want to just remind folks of the Men's Health Month celebration that's taking place on Thursday, July 30th. This information will be on the Greater Milwaukee Urban League's website, as well as our social media. So feel free to visit us at tmul.org. And before we let you go, on that note of water, how important is water to our health, our overall health?
Water has everything that we need to survive. As a matter of fact, if we're on a deserted island and we have food but no fresh water, we're not going to live as long. So we want to make sure that water is a part of our ingestion activity every day. If we can get close to a gallon of water a day, that's perfectly fine. I know that's not going to be everyone, but we should at least shoot for it. If we can get more than 8 ounces in, that's great, because it replenishes our supports for our organs and keeps them healthy, and our brain. It also is a delivery source for oxygen in the cells. So yes, water is extremely important, Faith, and we want to make sure that more people are drinking water consistently, because that's what's the high composition of our body is water.
Well, I want to say thank you again to you, Daryl, for joining us today. That was an incredible presentation. I want to thank our sponsor, Rebecca Stanis with Humana Eye Care. And remind folks again that you can reach Daryl at 414-286-0222. To see this presentation again, you will be able to visit our YouTube channel and tmul.org, where you will find this presentation along with the flyer of the event that's taking place on June 30th. We want to remind you to join us for our next Conversation Wellness on Thursday, July 28th at noon, where our guest speaker will be Sherry Tesler, the Executive Director of Hunger Task Force, and she'll be talking with us about food insecurity and the work that they're doing in Milwaukee. I want to encourage everyone to have a safe and wonderful rest of the week. And until next month, keep having conversations about wellness. Take care.